I see this happening over and over, but evidence supports that we do not perform rotation exercises with the lumbar spine. And there's a simple biomechanical and anatomical reason why we shouldn't. Let me show you. When we look at the vertebra in the lumbar spine, we see that the facet joints are oriented in what I call a book reading position. My axis of rotation for the segment in the lumbar spine is through the vertebra. What that means is if I'm going to rotate around that axis, I am built for 0 degrees of rotation. So it's not even built for rotation. Evidence shows, however, is that when I have back pain, as the segment begins to age, that axis of rotation shifts backward to what we call the spinous processes. And when that happens, my facet joints are now on the circumference of that rotation. And now when I perform rotation exercises, I get a swinging of the segment, which further degenerates discs and creates bone spurs and creates facet arthropathy and further damage. So if we look at another human example, this is an actual human vertebra, we can see that this individual underwent a period where they had aging in that segment and they performed rotation, and that created significant bone spurs. Not just this large one, but numerous at another level. And bone spurs can end up pinching nerves and lead to years long of problems. So if you have back pain, stop all stretching, rotation, and strengthening rotation exercises in the lumbar spine.